Okay.
Hi, I'm Declension Abby.
Hi, Taylor.
Okay, today I'm going to be performing some tests on you. If anything I do hurt you, please let me know. If you have any questions, feel free to ask. Everything you tell me is strictly confidential. May I begin? Okay, so we're going to start off with some reflexes. This is my reflex hand. I'll be using it to test the reflexes. So we're going to start with the jaw reflex. For all of these, I'm going to ask you to keep your eyes closed, okay? So go ahead and open your mouth for me. And I'm going to place my thumb on your chin. Okay. And now we're going to be testing the bicep reflex. So go ahead and supinate your hand. I'm going to traction down. Go ahead and make a muscle for me and relax. Okay. Okay, and we're going to do this side. And go ahead and make a muscle for me and relax. Now we're going to do the brachioradialis. So I'm going to put your hand and this side. Okay, and now we're going to do the tricep reflex. Okay. Now we're going to be doing, go ahead and let your legs relax off the bench. And we're going to do the patellar reflex. And the Achilles reflex. Okay, now we're going to do the gymnastic maneuver, which is when one of the reflexes might not be working. So I'm going to test the brachioradialis. So for this, I'm going to ask you to cross your legs and act as if you're trying to pull them apart as I try to elicit the reflex, okay? Put your arm like that. Okay, and this way. Okay, and now we're going to do it on the top. So go ahead and hold your hands like this. Make sure your eyes are closed and relax your legs. And go ahead and try and pull them apart as I elicit the response. Okay. Okay. So now we're going to be doing the direct light response. So I'm going to be shining this light into your eye. Okay, just go ahead and look forward for me. Okay. Okay, so for the direct light response, we're expecting the ipsilateral pupil to constrict, and that's going to be sensory for cranial nerve 2 and motor for cranial nerve 3. The integration center is going to be in the midbrain. Okay, and now we're going to do the indirect light response. So I'm going to shine the light back into your eye. Okay, go ahead and just look forward. Okay. And what we're looking for in this one is for the contralateral pupil to constrict, and that's going to be sensory for cranial nerve 2, and it's going to be motor for cranial nerve 3 in the ipsilateral eye, or the contralateral eye, and the integration center is going to be in the midbrain. So now we're going to do accommodation, so I'm going to ask you to follow this pen in, okay? Okay. And the expected response is convergence of the eyes, and that's going to be due to both cranial nerve 2 and 3. And that's going to be, the integration center is going to be in the occipital lobe. Okay, now we're going to do the oculocardiac reflex. So I'm going to, take your pulse, and I'm going to ask you to close your eyes, and I'm going to lightly press over your eye. Okay, and the expected response is for the radial pulse pressure to decrease after pressing on the eye, and that's going to be due to cranial nerve 5 for sensory and cranial nerve 10 for motor, and the integration center is going to be the medulla. Now we have the carotid sinus reflex, so I'm going to be doing the same thing, except I'm going to be pressing on your carotid sinus. I'm going to take a pulse. Go ahead and just look forward. You're not going to press. Okay, so the expected response would be for the radial pulse pressure to decrease after placing pressure on the carotid sinus, and that's going to be due to cranial nerve 9 for sensory and cranial nerve 10 for motor. Integration center is in the medulla. So for this test, I'm going to be doing the ciliospinal reflex. So I'm going to pinch the base of the neck, and the expected response is dilation of the pupil. So just go ahead and look forward. And that is going to be the cervical sympathetic chain for both sensory and motor in the T1, T2 spinal cord for the integration center. And then I'm going to just describe the gag reflex. So I'm going to stick a tongue depressor in the back of the mouth, in the back of the tongue, and expect the gag, or do an initial gag, and then the nerves are going to be cranial nerve 9 for sensory, cranial nerve 10 for motor, and the integration center is going to be the medulla. Okay, now we're going to be demonstrating the scapular reflex. I'm going to take this brush, and I'm going to be going like this and this. Okay, and then go ahead and lay on your back for me. We're going to be doing the abdominal reflex. I believe that's what it's called. Yeah. So we're going to stroke towards the umbilicus. I guess. Is there any way to like flip this? No.
Yeah. Oh, no.
How do you flip it? The abdominal reflex, we're just going to stroke towards this. Okay. Okay, so we're going to do the plantar reflex. And normal responses for the toes to curl. The Babinski reflex test is the exact same procedure, but it would not have the same elicited response. Okay, so now we're going to be doing alternate ways to elicit Babinski sign. So we're going to start with the Oppenheim sign. It's going to be pressure in the anterior portion of the tibia. Stop. Okay. Now we're going to be doing the Chaddock sign. It's going to be pressure on the lateral portion of the leg, wrapping around the malleolus and down. And same thing on this side. Lateral malleolus and down. Okay. Now we're going to do Gordon sign, which is just going to be squeezing the calf muscle. And I think the next one was Schaefer's. Yeah, so Schaefer's is going to be squeezing right here. And none of these were positive. So the positive for Babinski sign, Oppenheim sign, Chaddock sign, Gordon sign, Schaefer sign is going to be dorsiflexion of the big toe and fanning of the other toes upon stimulation of the plantar surface of the foot, lateral to medial, plantar reflex. Now we're going to do clonus sign, or the ankle clonus. And the abnormal response is going to be continued involuntary contraction of the foot upon quick, forcible dorsiflexion of the foot. So I'm going to go and side. Okay. Next test is going to be the Hoffman sign. And for this one, I'm going to ask you to sit up, and I'm going to use your hand, and I'm going to take the middle finger right here. Let's see if we can get a little bit closer. We can come like over here just so that you can see the middle digit. So I'm going to hold it, and I'm going to flick it into flexion while paying attention to your thumb. Let's do it real quick on the other side. So I'm going to hold this, flick into flexion. And the positive is going to be, I think it's abduction. So it's going to be, the positive is going to be flexion and abduction of the thumb with extension of the fingers indicating an upper motor neuron lesion in the cervical cord or brain. And now we're going to do Tromner sign, which is so I'm going to take this. So the positive for Tromner will be flexion of the fingers and thumb upon tapping the palmar surface of the middle 3 fingers. So I'm going to take your hand like this, go ahead and open it, and try and don't like relax it, but try to keep your fingers like open like that. So. Okay. Okay, so now I'm going to be demonstrating the increased tendon reflex. And then right here. So yeah, like that excess swing of the leg is going to be a positive. And now we have the Romberg sign. A positive Romberg sign would be an inability to maintain balance and stand up straight. So for this one, I'm just going to ask you to stand up, and I'm going to stay pretty close to you. Just go ahead and close your eyes. Okay, and she does not have a positive Romberg sign.